What's up, y'all? It's Mushfik here, and today we're going to be talking about what is ADHD. Oftentimes people talk about ADHD and yet have no understanding of what it is, and it's talked about online so much. So today in this video we're going to be talking about what it is, what to look out for, and what that entails. So let's get right to it. Now, ADHD stands for Attention Deficit and Hyperactive Disorder, which according to the DSM-5 is a neurodevelopmental disorder. A DSM-5 is basically a giant book that the medical world uses for categorizing mental health struggles. Although hearing the term disorder might be scary at first when you hear it, especially with ADHD, one of the things I always like to tell people is that it is not the end of the world and people live highly functional lives and live full lives with ADHD, as I do too as someone that has ADHD. ADHD, basically what it entails is a neurodevelopmental difference within the brain, which basically means that your brain has developed differently than those of neurotypical brains or normal brains that we consider. ADHD doesn't necessarily mean an inability to pay attention. The attention just looks different. People with ADHD don't often have a lack of attention, it's the difficulty of regulating their attention. So I often think of it as a remote changing TV channels. Those without ADHD are able to just look at one TV channel and just focus on it perfectly fine. Whereas ADHD brains will keep on clicking through different channels, struggling to pay attention to just one, or they're paying attention to multiple things, which can be very dysregulating in a normal world where you have to just focus on one thing at a time. ADHD, if not managed well, can often affect multiple areas of your life, like, for example, time management or emotional regulation, or things like relationships and being able to maintain strong relationships, or even academics. All these can be affected if we are not managing our ADHD symptoms well. According to the DSM, ADHD can also be divided up into 3 different types. The first one being inattentive. These are the people that will often daydream or lose focus on something completely, or lose track of time and come back to things and not understand where they are, or have completely lost attention. This can be very distressing if not managed well. The second part of ADHD can be hyperactivity and impulsivity. This can look like being restless, being fidgeting all the time, impulsive decision making, and oftentimes talking over other people without noticing that you are talking over other people. Oftentimes these are the people that are sitting down but feel like they're about to jump out of their seat. And the last one and most common one is the combined type, which basically combines both inattentive and hyperactivity, and you'll have a mixture of both of those things. This is the large proportion of people that have ADHD. Although ADHD does not go away with age or does not have a perfect cure for it, there's not necessarily a need for it. ADHD can be perfectly managed with things like therapy, coping skills, or even use of medication. Sometimes traits of ADHD can also be beneficial in our day-to-day lives. For example, hyperfocus can help us be really passionate and knowledgeable about the things that we are interested in. Being able to work in high-pressure environments, ADHD can often be an asset because you're able to focus on multiple things and also work in high-speed and high decision-making environments. People with ADHD can often also find unconventional ways of finding problem-solving strategies because the brains of people with ADHD literally work differently than those of neurotypical people. So ADHD doesn't necessarily have to be a bad thing. In fact, it can be an asset, and with proper care and treatment, it can be managed really well. If you think that you have ADHD, it is often recommended that you see a mental health professional because they are going to be able to do a battery of tests to see if you do have ADHD, and also give you resources to help you manage your ADHD and also work with your ADHD rather than working against it, so you can have a successful life. Oftentimes ADHD will not go away with age, but it will look different as you get older. And as you get older, you're going to need different tools, and a mental health professional is always going to be able to help you with that. And that's our video on what is ADHD. If you like this video, please feel free to like and subscribe, and I hope you have an amazing day.